Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. For those of you who don't know me, let me introduce myself. My complete name is Safira Yuliana. I am the student of Faculty of Medicine, Sultan Agung Islamic University, Indonesia. As you can see on the screen, the topic of our presentation today is the common errors in focusing the light on the retina or refractive errors called short-sightedness and long-sightedness. Today's topic is of particular interest to those of you who want to know more about the two refractive errors. My presentation will take about 20 minutes. As we may know, our eyes are exceptionally well-designed camera that use simple yet intricate optics to make us see clearly. Did you know that eyesight problems are common and often do not occur because of eye disease? People can have healthy eyes but still be short-sighted or long-sighted. The good news is that most people with either short sight or long sight can be treated if they have access to corrective lenses in the form of glasses or contact lens. It is also possible to correct many refractive errors by laser eye surgery. And this is the next slide. Okay, to start with, I will talk about the normal vision, then I will give you a short introduction on how our eyes work in a normal vision. After that, I will talk about refractive errors and the treatments. Finally, I will talk about short and long sightedness. Let's begin by normal vision. You have probably heard the saying, I have normal vision. But what does that really mean? As you can see in the scenario, 20/20 means normal vision. 20/20 is a term used to express normal vision or visual acuity tested by reading a Snellen eye chart at a distance of 20 feet. If you have 20/20 vision, you can see clearly at 20 feet what a person with normal vision can see from 20 feet. Calling normal vision 20/20 vision is true for eye care professionals in the US, but not everywhere in the world. In the Europe and elsewhere, eye care professionals would say that normal vision is 6/6 vision because they use the measurement of 6 meters instead of 20 feet. Can your vision be better than 20/20? Yes, having 20/20 vision means you have normal or average vision. Contrary to popular belief, this number is technically not considered perfect vision. Some people, mostly children, have vision that's better than 20/20, like 20/15 vision or 20/10 vision. This means that you can see something 20 feet away, like a line on an eye chart. The most people can see when they are 15 feet away, 20/15, or 10 feet away in a 20/10 vision. That's all I have to say about a normal vision. To understand the eye disorders, we must first understand how they help us to see. So let me turn now to know our normal eyes to help to see. Your eyes works in a similar way to a camera. The different parts of your eyes work together to help you to see image and send visual information to your brain. This process all happens extremely quickly. The front of the eye is made of the cornea, iris, pupil, and lens, and focus the image into the retina. The cornea is the clear front window of the eye, And the iris works like a shutter in a camera. It has the ability to enlarge and shrink depending on how much light is entering the eye. The lens works like the lens in a camera, shortening and lightening its width in order to focus light rays properly. The retina function much like the film in a camera's. It is like sensitive membrane that covers the back of the eye. This membrane consists of millions of nerves cells which gather together behind the optic nerve. When you look at an object, like reflect from the object enters your eye through the cornea and goes to your lens. Your pupil gets bigger and smaller to control the amount of light that gets into your eyes. Your cornea and lens refract bend the light to bring what you are seeing into a focus. Like reach, the retina at the back of your eyes and the retina change the image into electrical impulse or signal. The optic nerve transfers the signal to the part of your brain that's responsible for vision or in the visual cortex. The optic nerve carries signal from both eye at once. Your brain interprets what you have to be seen. It's combined the visual information from both eye and brings it all together into one clear image. I have told you about how our eyes work. And then let's move on the eye disorders that affect the eye's ability to refract or bend light. It means that the shape of your eyes does not bend light correctly, resulting in a blur image. This makes it is so difficult for the eye to focus on what is seeing. Depending on the type or refractive error, you may struggle all the time or only in the specific situation. The severity of the mirror determines how much it will affect your vision. Mild errors may hardly affect your sight at all, while severe errors may leave you unable to live a normal life without vision correction. You can have a refractive error in one or both eyes. When an error is present in both eyes, it may not be equally severe in both. You can also have different refractive errors in each of your eyes. There is usually nothing you can do to prevent a refractive error from developing in your eyes because they are caused by the shape of your eyes, cornea, or lens, or change to this part of your eyes. There's no way to prevent refractive errors. There are also nothing you can do to prevent your child from being born with a refractive error. Refractive errors are extremely common. Around 2.3 billion people globally have one or more refractive errors affecting their sight. There are four main types of refractive error. The one is myopia or nearsightedness. It is difficulty seeing the things that are far away. And number two is hyperopia or farsightedness, difficulty seeing things up close. And number three is presbyopia, an age-related form of farsightedness that sometimes happens when the lens of your eyes hardens over time. And the number four is astigmatism or blurred vision at all distance. That's all I have to say about what you need to know about refractive errors. And next slide is what are the symptoms of refractive errors? The most common symptom of a refractive error is blurred vision. Patients report symptoms of eye strain and blurring with difficulty in prolonged reading. Symptoms of double vision, hazines, glare or halos around bright lights, squinting, and headache may also occur. Some people may not notice the symptoms of refractive errors. It is important to get eye exam regularly so your eye doctor can make sure you are seeing as clearly as possible. If you wear glasses or contact lens and still have these symptoms, you might need a new prescription. Talk to your eye doctor and get an eye exam if you are having trouble with your vision. And next slide is, what's the treatment for refractive errors? Eye doctors can correct refractive errors with glasses or contact lens, or fix the refractive error with surgery. Glasses? Eyeglasses are the simplest and safest way to correct refractive errors. Your eye doctor will prescribe the right eyeglass lenses to give you the clearest possible vision. And let's move on to what you need to know about short-sightedness and long-sightedness. Short-sightedness or nearsightedness is also known as myopia. It occurs when your eyes cannot focus clearly on objects in the distance. You can be short-sighted if your cornea is too curved or if your eyeball is too long. When this happens, light rays coming into the eyes focus likely in front of your retina rather instead of on it, making faraway objects look fuzzy. Short-sightedness causes objects further away to appear blurred, which can affect your vision when you are driving, playing sports, or trying to recognize people and objects at a distance. This can lead to eye strain, headache, and fatigue. And the diagnosis is, nearsightedness is diagnosed by a basic eye exam. Your eye care specialist will likely ask about your child's or your medical history and ask about any medications. Farsightedness in hyperopia make it is fairly easy to see objects quite some distance away, but objects at least then arms, length, and blurred. It is the opposite of myopia. If you have farsightedness, you might be able to read words on a screen on the other side of the room clearly, but will struggle to read notes you are typing on your laptop that's right in front of you. Your eyes is growing too short from front to back causes farsightedness. Another causes is your cornea or lens being too flat, not being curved enough. These defects cause light rays to focus just behind the retina. I think people with farsightedness are usually born with it. Also known as hypermetropy, longsightedness affects the way you can see the objects in close range. People who suffer from longsight are usually able to see objects in the distance clearly, but not those nearby. You can be longsighted if your eyeball is too short or your cornea too flat in a curvature. These defects cause light rays to focus just behind the retina, so it is fairly easy to see objects quite some distance away, but objects at least then arm's length are blurred. This is usually a result of genetic. If others in your family have it, you are more likely to develop longsightedness. And it is possible for anyone to be longsighted at any age, but it is almost inevitable that you become more longsighted as you get older. Age-related longsightedness is called presbyopia, and it develops in most people in their mid to late 40s. It is not a disease, but a result of natural aging in which the lens inside the eye becomes less flexible. And that concludes my presentation today. And in conclusion, the vision is more good if you have a good food. And thank you for your attention. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.